Respectfully, no, it's not. And you should demand that your scar outcomes are as good as a fair-skinned patient. And let me tell you how I do that in my practice, because it is achievable. And again, you should be demanding this if you have darker skin. So in the operating room, what I do is I avoid heat energy near the skin, near the dermis in particular. That's going to help minimize the chance of PIH, or inflammatory pigmentation, that can form from too much energy and heat near the skin. The next thing is that when I use skin staples, I use them sparingly. So we don't use staples to close incisions in plastic surgery for the most part, but we do use them in the operating room when we're just preliminarily assessing shape and making sure everything looks okay. So if you have to do this too many times, you run the risk of causing inflammation and trauma that can lead to pigmentation. So if I find the need to do this, I'll start doing internal tacking stitches instead in darker skinned patients, and this will help minimize that. It takes a little bit more time, but it's definitely worth it. The next thing that I do is a Prevena wound vac. I use Prevena wound vacs on all of my plastic surgery procedures that have higher risk for healing and scarring problems, and they do an amazing job. So that's going to be my reductions, my lifts, and my abdominoplasties for the most part. It's a wonderful device. It helps healing, and I can't recommend it highly enough. Now, after surgery, there's some things you can do too. So once you initially heal, it's really important that you start on some kind of topical scar regimen. So I love silicone products, and I have all of my patients on silicone products for the first couple months after surgery. The other thing that's really important and often overlooked is sun protection. Sun protection is vital to prevent your scars from turning funny colors, and darker skinned people have higher rates of this. So even if you're dark skinned and you don't typically sunburn or tan, you want to protect that scar in the first 6 months to a year minimum so that you don't get pigmentation issues, and you can get sun exposure through clothing. It often only has SPF 15 or so. So it's really important to add the sun protection to that. So that's what I do on all of my patients, whether you're a Fitzpatrick 1 or a Fitzpatrick 5. And I have really good scar results, and I often don't need to do anything else. Now, people with darker skin do have higher rates of certain issues with their scars, and we can manage those too. So hypertrophic or inflammatory scars are more common in darker skin individuals. And the key to managing these and eliminating this as a problem is early intervention. And I love 5FU, that's my injectable of choice, but usually these are managed with injections for the most part. Easy to do, and intervening quickly, like I said, will eliminate this as a problem, and it won't get like thick and ropey and not look good. The other thing is just pigmentation issues, and these are usually pretty easy to manage as long as you intervene quickly as well. There's topical agents, there's oral agents, there's procedures that we do, there's all kinds of options. So again, people of color deserve and should expect the exact same scarring outcomes as their lighter friends, and I think that that should be the expectation, the standard of care for all patients.